today that you'll be able to complete your application to become a NAHQ volunteer and to make an impact on the future of NAHQ and the healthcare quality profession. Here is our agenda for the day, and we will hear from NAHQ volunteers on their experiences as a NAHQ volunteer, and we'll also have time for your questions at the end. So if you have any of those, as Juliana said, then we can do those at the end. So you have on your PowerPoint the agenda. So we're going to talk to you today about why volunteer, and then how does my volunteer or how does my work impact NAHQ, and what can I volunteer for? How do I volunteer, and what does being a NAHQ volunteer mean? And again, we'll have Q&A at the end. So on our next slide here, we have why volunteer. So we're going to do a poll here in a second, and this is what we have come up with as potentially from some of our past experiences as to why we volunteered, and wanted to get your input as to why you are seeking or considering volunteering. So let's see, we're going to take the quick poll.
Okay, and we've gone ahead and closed the poll. I'll just take a second to process. It looks like the majority of people stated that they are interested in volunteering for the purposes of professional development, which is closely followed by support of the profession.
All right, very good. Okay, well, just wanted to talk to you a little bit about usually the most common reason why people volunteer is because someone asked them, and that's exactly what happened with me. I actually started volunteering with NAHQ in 2002, so I've been a volunteer since 13 years now. And I actually got my first encounter with NAHQ way back in 2002 when I went to the conference and saw Faye Wilson, who was the president. And she was talking about NAHQ at the time, and again, my first time, and I was just really mesmerized at the organization and what was going on, because I was a new quality professional and I was looking for help to be able to advance my career as well as feel comfortable in what I was doing there. And after that, down in Orlando, Tennessee, and that's where I'm from, actually won the award for the state that year for Best Excellent in the state. And Jack Hartley, who was the president, incoming president, he was responsible for assigning team members, and he came up to me and asked me if I would be interested. And he appointed me to the conference planning team at that time, which was very gratifying and rewarding, and I had the opportunity to help in the next conference, which I believe was in Boston after that. So I've been volunteering ever since, and I think looking at some of the things like professional development, curiosity, support the professional, personal goal, and reflect is basically everything, because when I first started I was very curious, but also looking at it to be a professional development and support of the profession. On our next slide, this talks about NAHQ strategy and our mission and vision. NAHQ recently adopted a new strategy plan that will position us to advance the healthcare quality profession and ensure that the profession is recognized and valued as essential. NAHQ relies on dedicated volunteers to advance the mission and vision of the organization. On our next slide, this talks about the strategic plan, and to focus our volunteer efforts, NAHQ, we've identified 4 goal areas that the teams will work on to support and carry out the strategic plan. Certification is one of those. NAHQ has offered the certification for over 30 years, and it's grown tremendously. By calling it out as a goal area, we reaffirm our commitment to prompting and advancing the profession. Recognition of the profession is our second one. It's when a professional is recognized, it is a valued recognition. We aim to position healthcare quality professionals as critical to delivering healthcare quality. We also want employees and employers to recognize the professional's values. This direction reaffirms our commitment to our members' career development and advancement. The third one is competencies. At the 2013 conference, we kicked off a discussion session about the future competencies of the healthcare quality professional. Since that time, much has been done. We plan to publish and develop products to support our members and the healthcare quality professional as they adapt to meet everyday needs. Education is the fourth one, and that is where we are reaffirming NAHQ's commitment to the education that we plan to bolster CPHQ prep courses, develop more products for healthcare quality professionals in the area of performance and process improvement, population health and care transitions, clinical data analytics, patient safety, peer review and quality accountability, regulatory and accreditation, and we plan to deliver more online remote content, for example, the webinars. On our next slide, we talk about the 2016 NAHQ teams, and you'll see the diagram there. We have many opportunities for volunteers. At any given time, we have over 100 volunteers that are working to support the strategic plan. All of our teams support the four goal areas. When you visit the Volunteer Activity Board, you will find team descriptions of each one of these. Take a look at the different areas and decide where your passion and skills align and volunteer for teams related to that goal area. Essential competency volunteer opportunities are on a different cycle for volunteer appointments, and currently we are seeking subject matter experts for regulatory and accreditation. On our next slide, this talks about the teams of the board where we have finance and leadership development, and we also have terms on the board that support the organization as a whole, so these teams report directly to the board. What can I volunteer for? Again, we're looking for volunteer expectations and the staff support, and what we have defined is that all of our volunteers are dedicated to advancing the mission of the organization. It is expected that if you indicate that you are interested in volunteering, that you will make the time for the volunteer commitment. From time to time, conflicts do come up, and the NAHQ staff can work through those with you, but take the time to assess if you are able to commit to volunteering. Speaking of NAHQ staff, all of our teams have staff support and are there to support you, and you carry out the important work of the organization. And I know, speaking from my staff, we could not do it without them. They have been very engaged, very dedicated, and always come to our aid when we need to. Additionally, if you have any questions after this webinar, you can certainly reach out to them if you're not sure which team might be right for you, or if you have any questions on how to volunteer. On our next slide, this is talking about how to volunteer, and we have a website there for you to do. So in order for you to let us know that you're interested in volunteering, please visit our Volunteer Activity Board and indicate your interest along with telling us a bit about yourself, your past volunteer history, and why you wish to volunteer. That's so important as we're reviewing the applications. If you have filled out an application before, I encourage you to go back and update your interest as it has recently been redesigned, and let us know if you are currently interested in volunteering. With that, I will pass it on to our current NAHQ volunteer, Tony Heath, to give us his reflection on what being a NAHQ volunteer means to him. Tony?
Thank you very much, Michael. My name is Tony Heath, and when I was young and in college, I started as an architecture student, but decided that people and helping more than drawing pictures. So I stumbled into the innovative field of family therapy. Early on, I attended a national conference and found it exciting. Learning, fame, intrigue, and romance, all in a fancy hotel. Wanting all these sins, I volunteered through my professors for a committee. The conference committee of the American Association for Marriage and Family Therapy was almost as much fun as the conference. Learning, fame, intrigue, and romance, all in a hot conference room. I didn't mind. I was young. I also discovered a local opportunity joining the Illinois Association for Marriage and Family Therapy. I started my work in healthcare quality in 1998, and by 2004, I'd moved to United Health Group. My new manager there was named James Enos, and he is a CPHQ. I asked him what CPHQ meant, and he said it's a credential admired in medical quality. And he knew that I'd worked in primary care at some point earlier, and he said this could possibly help you move out of your silo called behavioral health and into the larger medical field. So several of us began study for the CPHQ and discovered NAHQ. Soon I realized I know how to do this association thing, so I found the Illinois affiliate and volunteered online for NAHQ. Because I could talk conferences maybe, I was allowed onto the conference planning team. Now I've served on several NAHQ task teams, and I'm about to be president of the Illinois affiliate. Service to organizations is rich for me. Learning is rich. There's opportunity to lead. The politics are amusing, and there's a chance to make things better. It's both slow and fast, as is the work. I think most people see organization service as frivolous or even selfish. They don't understand the complex nature of service. But an occasional boss has found it worthy. For example, last week I told my team of about 80 black belts about NAHQ's National Summit on Transitions of Care, which I attended in Philadelphia earlier this year. A senior QI leader, actually the boss of my boss, said after my talk, we should all know this material and deliver it to our customers. And for me, service to NAHQ and IAHQ is still about learning. It's also about long-term friendships, interaction with the best and the brightest, and a chance to add a little value to my profession. Thank you.
Great. Nancy?
Good morning. Good morning, everybody. My name is Nancy Terward, and I'm from the great state of Ohio. And I'm going to talk a little bit about my experience with NAHQ over the years. I've been a longtime member of NAHQ, and I actually became a certified professional in some of the first few years. I think it was the late 80s, if you can believe it or not. I was working for United Healthcare, and this certification came across, and so my boss thought it was going to be a good idea for us to become certified, and that was back in the day where we went, I think we drove to Pittsburgh and spent 2 days in a review course and then took the test right away, and it was paper pencil, and then waited like 4 weeks for the results. But we all passed, and I became certified back then. And then in the 90s, in my infinite wisdom, I let my certification lapse. And I thought I wasn't in a job that promoted it. I was still in healthcare as a nurse, but I didn't work in quality, and I thought, oh, this is, I don't have time to do the CEs, and nobody's paying for it, and so I let it lapse. And then, less than 5 or 6 years later, I turned around and I kept seeing all these CPHQs, and I'm thinking, oh man, I need to get that certification back. And they wouldn't let me just pay for it. I had to retest, which was a bummer. So I did, and I promised myself I'll never, until I retire and quit working altogether, will let that certification lapse. But actually back then, when I first took it, I was a CPQA, Certified Professional in Quality Assurance, and so that's changed. And I actually, the first time, like Michael said, I got involved in volunteering at the national level was because somebody asked me. And I had been coming to a couple national conferences. I actually went to a national conference and in the exhibit hall stumbled across the Ohio Association booth. And I hadn't realized that there was an Ohio Association. Usually you find your state or local association first, and then they turn you on to NAHQ. But I was actually at the NAHQ conference and found out about Ohio and have been very active in the Ohio Association ever since then. And I was at one of the NAHQ national meetings, and back then we had business, like a business meeting during the conference where the membership got up and the board talked to us and told us, some of the strategy. And I'll never forget Tom Smith, who was a former president of NAHQ, was conference chair at that time, and they were talking about the call to post for posters and calls for abstracts to become a speaker at NAHQ, and I didn't like something that I thought, in my opinion, they're asking for this information way too early, and how are we going to know what really are the hot topics when you have to turn in a poster or an abstract so far in advance of the conference. And so I was speaking and complaining, if you will, about this. And afterwards, Tom Smith approached me and he said, well, how would you like to be on the conference planning team since you have so many ideas? And so, the rest is history, if I might say. I spent about 3 or 4 years on the conference planning team, actually planning conferences, and was the conference chair for one of those sessions. And that sort of began my history with volunteering. I got into it. I was very eager to help the profession because in my own mind, like I had said, I thought I'd gotten out of healthcare quality because I wasn't in a job that had quality in my title. And I've realized now, if you're in healthcare today, actively working in healthcare, then you are in healthcare quality. And I wanted to get us out of the basement and into the C-suite, if you will. I remember back in my hospital days, the quality department was always downstairs in the basement next to medical records. And I saw NAHQ trying to make those steps to promote and refine the profession of quality. And I wanted to be a part of that. And I really have watched NAHQ grow, as well as myself, through all my involvement. I had the honor of being a board member. I was on the board of directors for NAHQ for 3 years. And after that, I continued to stay active and be involved, and am now a member of the Education Committee. And for 2015, I was the Summit co-chair for our first ever NAHQ Summit. So I personally have gotten so much from NAHQ. The networking opportunities are unimaginable. I really feel like I have a contact in almost every state across the country that I could pick up the phone and call and ask for something, or just say hi, or hey, I'm going to be in the state, I want to come visit you and see you at work. It's just been a phenomenal opportunity that has allowed me to grow very much professionally. And I have to stop with one funny story that came about because of NAHQ and my networking with members across the country. I got a call about 2 months ago. This just happened. I got a call from a fellow NAHQ member, Lee Hamilton, again, once our NAHQ president, and she and I have maintained in contact. We're Facebook friends and we email each other, and she called me because in her day job as a consultant, she was working with a company that was bringing a group of 6 or 7 physicians from Kazakhstan, a formerly Russian country, to the United States to look at accreditation. And they were coming to Ohio because the DNV is located here in Ohio in the Cincinnati area. And she was looking for hospitals so that they could take a tour of a Joint Commissioned hospital. So she called me. I'm in Dayton, Ohio, about an hour away from Cincinnati, but she said she was the only one. She thought of me when she thought of Ohio. And did I know somebody in Cincinnati that I could maybe put her in contact with? Well, I reached to my local chapters of association members and found a couple in Cincinnati and tried to make some connections. And long story short, no, I couldn't get any takers in Cincinnati that wanted to host this visiting group of physicians. So I said to Lee, I said, well, if you want to come to Dayton, I'll see if my hospital will do it. And I work in a large hospital system, but I'm over the physician ambulatory offices. So I don't have all the ins and outs, and I certainly couldn't lead a discussion with them on Joint Commission because that's not what I do. But I made the connections in my hospital, and before I knew it, I was there, facilitating this one-day visit from these 6 physicians from Kazakhstan, and they came to our hospital, and they toured the emergency room, and we have a helicopter care flight that they toured, and I even managed to make sure that they were airlifting somebody. The helicopter took off and landed while they were there up on the roof, which was they were delighted to see. But this never would have happened without the network connections that I made through NAHQ. It turned out to be fabulous for the hospital because the hospital bigwigs were all there, the TV stations were there, we made the 6 o'clock news. So my name was out there with the CEO who thanked me for making this happen. And so it was really good for me professionally because, I knew somebody that made this happen, and I really didn't do any of the hard work, but I was able to bask in some of the award of it all. And again, it never would have happened had I not been a NAHQ volunteer. NAHQ has meant a great deal to me, and I am very dedicated. And I've grown so much, and I've learned so much, both as an association and as a quality professional. And it's been a lot of fun as well. We have excellent staff, and when you think of association staff, I don't know what you think of if you've ever even thought of it, but I can tell you that the association we work with recruits the very best, and these people are very much committed to the quality professional and are as passionate about quality and the professional as we the professionals are. And we couldn't do it without them, and they are invaluable to us. So that's my story. I'm happy to answer any questions as we move forward, but good luck to you all, and hang in there, please. We always need good volunteers, and the NAHQ board is always looking at their list of volunteers for potential leadership opportunities. So if you're interested in one day being on the board or being president of this great organization, this is the way to start. So thanks.
Thank you, Nancy. That was a great story there. And Nancy and I go back a long way, and as she said, the networking is great because I would have never met Nancy or been able to work with her on the conference planning team and or the board, and it's been a great experience knowing her and also as she has gone through her journey on the quality arena, so very good. So we're going to close with some questions, but we wanted to, again, remind everyone that it's truly a networking rewarding opportunity. We are looking for talent out there to help this organization to continue its journey into being the source to come to for the quality professional, and we definitely are looking for those folks out there who are willing to consider some of these areas and to give us some of your time commitment, and we are happy to answer any questions at this point related to the volunteer or the different areas open. So staff, if you can help us open up.
Yes, so we will be facilitating any questions through the chat function, so if you do have them, please submit them. The chat function is on the right side panel of your screen. So the first question we have is, what is the reasoning behind asking for a CV or resume for a volunteer?
Oh, well, that's certainly just the point of introduction, so it helps us to be able to see, number one, who you are, where you work, where your area of work is, and that helps us sometimes to be able to suggest what might be the better place for you to volunteer. So that's, again, mostly for us to get our introduction and to see what your expertise is.
Great, and just in follow-up to that, we also try to make sure that we have a variety of representatives on our volunteer teams across the continuum and in different areas so that we have the broadest scope and information coming to us from our volunteers. The next question is, do I need to be a CPHQ to volunteer?
No, I do not believe that we are requiring that. There may be some, for example, on the test development and the HQCC, there is a requirement that you are a CPHQ, but I believe that on our other ones, And Jessica, you can correct me if I'm wrong, that that's not a prerequisite?
That is correct.
Yeah.
So the next question is, where do we see the opportunities available on the website? If you go to NAHQ.org/volunteer, you will find all the information about volunteering, and when you go into the volunteer board, there's drop-down boxes to see descriptions of each of the volunteer opportunities. We will be sending a follow-up email out to everyone on this call today that will have a direct link for you to reach that site. And also, if you have any questions as you get into it, feel free to email info@nahq.org. Let's see. Next question is, do you have to have your CPHQ to volunteer? Which we already answered that part of the question is no, you do not. If not, do you get a discount to take the CPHQ if you volunteer? Go ahead, Michael.
I don't believe so.
You do not. So there is a member, non-member pricing structure for the CPHQ exam. So if you're a NAHQ member, there is a reduced cost. But being a CPHQ is not a requirement of volunteering, unless it's for the test development team or the Healthcare Quality Certification Commission. All right, we'll wait just another minute to see if any other questions come in. And again, you can email us at info@nahq.org to follow up with any questions after this session.
And Jessica, this is Nancy. Just to kind of go back to the question about CPHQ and discounts, et cetera. I mean, these are volunteer positions, so they're not reimbursed, they're not paid. You know, sometimes if there's an activity where you need to have a face-to-face meeting, then NAHQ does provide the cost of coming to their headquarters, if that would be part of the deal. So there's no out-of-pocket expense that you incur, but this strictly is volunteer, and it is, obviously, as Michael said in the intro, there's a time commitment that, we all have day jobs for which we get paid, and sometimes those have to take priority. So you really want to make sure that your employer knows about your volunteer desire and supports that, because you might have to get on a couple of calls during the day, or do some things that take up time during the day. So it's always good to get the employer involved, and it also then it lets them know that you're reaching and trying to do something to promote yourself and your career, and that's never a bad thing. But it is really a volunteer job, and I think to be a board member, you do have to have your CPHQ.
Correct. Thank you, Nancy. Someone asked if we could put the slide back up that showed the different volunteer opportunities. So we did put that slide back up. Again, the items in gray are the ones that there are current opportunities to volunteer for, and these are also all listed on the volunteer activity board as well. Next question is, what kind of time commitment is there for volunteering? Michael, you want to start with that?
Sure. It's going to vary depending upon what your interest is. We certainly try to keep it to a minimum, but there are some that will require periodic phone calls throughout the year. For example, on our education committee, which is up and running, they actually had an on-site visit or a meeting that occurred 2 days to be able to kickstart that off. There. So some of these are still to be defined, and I'm not sure, Julianne or Jessica, if you can share anything that you're aware of.
On the volunteer activity board, it does say approximate time commitments for each of the different teams. It does vary from team to team. And also some of the teams have highs and lows throughout the year. For example, the Healthcare Quality Foundation, when we're having grant applications come in, there's high times for scoring and calls for that, but then it slows down as well. So it does vary. We're having a few technical difficulties and unfortunately can't get back to that slide with the different opportunities. But again, we will send all this information out to you after the call.
Yeah, is it something that we can say? I can go back and look. So
yeah, I can talk through them.
Yeah.
So there's opportunities for the 2017 conference planning team, the awards team, the fellowship review team. That team does have a requirement that you must be a current NAHQ fellow. The special interest groups, the state leaders team, the Healthcare Quality Foundation, and then the regulatory and accreditation team as a part of the essential competencies, the Q essentials. So those are the current opportunities.
And this is Nancy again, and one of the things, you know, if you go in and look at these, you'll be able to see some of the time commitments. So, you know, if you're not sure but you're kind of interested, start out with something small that doesn't require a lot of time commitment or effort at this point, and, you know, get your feet wet and see how it works. You might not want to jump into conference planning right off the first bat, or the education team, which is looks like it's going to, you know, take more work. But start out slow if you're unsure or you're not sure that you have the that time commitment from your employer. So there's something for everybody, and every single opportunity is needed. You know, none is better than the other. We all need all those components to really make NAHQ work.
Thanks, Nancy. The next question is, if you want to volunteer for one of the positions that require the CPHQ, but you do not have a CPHQ, but intend to take the exam to get it, can you still be considered for the CPHQ required position, provided that you meet your commitment to take/pass the exam? And unfortunately, due to the timing of appointments, we cannot accept any applications for those positions unless you currently hold the CPHQ. So if you do intend to take it, that is great, and we would consider you in 2016 for volunteer opportunities, but due to timing requirements, it's not able for this year. Michael, anything to add to that?
No, that would be correct. It's really related to the timing issue that these teams will be appointed soon, and so 2016 certainly would be the earliest.
Great.
Or for 17 teams, right? Yeah.
Mm-hmm.
Yeah.
The next question is there a recommendation if you're unsure where to start? What would be a great team to start out with? And Nancy, you somewhat addressed that in your comments. Michael, do you want to add to that?
Sure. I would think that, again, if you're not sure, then just looking down through here, potentially the special interest groups would be something that you might want to consider. The
or the state leaders, maybe,
yes.
Michael.
Yeah, state leaders and the Healthcare Quality Foundation probably would be my recommendation, because the special interest groups you really get involved in are different groups, from whether it be acute care, home care, so you could apply for whatever is your area there, and then if you are involved in your state group, then you can certainly look at that, and then the Healthcare Quality Foundation. Like I said, the conference planning for 2017 is going to really be a big time commitment, and the fellowship requires to be a fellow. And I think through the regulatory and accreditation, that was going to require a lot of time since it's going to be a new team.
Great. And also we do have from time to time volunteer opportunities that come up throughout the year. So test development team, sometimes we have off-cycle appointments also for the different essential competencies groups throughout the year as well come up.
And that brings up a good point. This is Nancy again. I'm sorry I keep talking, but But that, going back to the question that the one person had about submitting your CV as a volunteer, that gives NAHQ a great repository when we're looking for certain people that have an expertise in a certain area. So if you are a self-identified subject matter expert on something and we need an additional resource, or we want somebody to take a look at this conference abstract that's been selected for presentation, but we're not really sure if this meets the needs of the general public, we might turn to those volunteers and say, hey, can you look at this? Can you vet this? And so it just gives us a great repository of what's out there and what our members have, because we all come with different backgrounds and working in different areas of quality, and that's what we're really looking for. So it's another good tool for us.
Great. The next question is, what is the deadline for submitting applications? And the deadline is July 31st. The next question is, on the site, does it have more detail on what each opportunity consists of? And yes, the Volunteer Activity Board has a very detailed listing of each team and what their requirements are and what the activities that they'll be doing throughout the year. So you can read more there. Let's see. The next question is, please verify that these are volunteer opportunities for 2017. Is that correct? Yes, these are 2017 positions except for regulatory and accreditation. That team will kick off, sorry, I read that. The question was about 17. These are actually for 16. Sorry. They are 2016 positions except for regulatory and accreditation, which will kick off probably late summer, early fall. But the rest are beginning January of 2016.
I'm glad you clarified that, because I was thinking, whoa.
Oh. Okay, the next question is, what is the limit or max number of volunteers? I've previously heard that NAHQ receives more applications than there are available positions.
Well, it's going to depend and vary upon the different teams that we have, and because this is a new governance structure that we're going to be working with, then we would certainly look at the applicants that are coming through, looking again at your resume, your interests, and see where the best fit would be for you on the teams that you are interested in. This is my first time of doing this and appointing, so I'm not sure about the question or the statement about we get more applicants than we have more, or for teams for, which I guess would be the case, but I'm not sure. Yeah.
So also, Mary Huddleston, who is our current president, is on the line, and she can help with that question as well.
Sure. Yeah, this is Mary Huddleston, and I know last year when going through the process, we did have more volunteers than we had slots. And I'll tell you, I know I've told this in smaller groups, if you have a passion for one of these areas, it really would be helpful to those of us on the appointment team to really specify which one is most important to you, because we have had people that volunteer for all of the teams, and then it's really hard to figure out, well, where's their passion, where's their interest. So I would, go for maybe two at the most that look interesting to you. And it's true, we typically, most of the teams don't have more than, I would say, 6 to 8 members. Once they get a lot bigger than that, they get a little unwieldy. Someone who asked about your CV or resume and why do we ask for that, if you have previous volunteer experience or team leading experience, definitely include that, whether it was in a state association or a NAHQ or some other organization. That's very helpful to us when we're trying to match up skills. If you have, particular area of interest or expertise, be sure and include that. But like Nancy and Michael said, things come up during the course of the year. Everything doesn't work neatly on a calendar cycle, so you may not be appointed. And then sometimes people drop off, personal things come up, and we need to fill slots. So please don't be disheartened if you're not selected the first time. We do have some wonderful members and a lot of talent to tap into, but it doesn't all come with this calendar cycle, so sometimes we have to look mid-year as well. Hopefully that helps.
Great, thank you, Mary. So that is all the questions that we have received thus far. Again, as you start to go through the process and have further questions, please feel free to reach out to us, and we will send follow-up information after this session to everyone who is attending. Michael, you want to wrap it up? Michael?
I'm here, sorry.
Okay.
So, yes, thank you very much for all of you today who's joined us and for your time, and we certainly encourage you to review what positions are out there and to submit your interest by the deadline, so because we're going to be starting to look at those and to appoint the team members for next year. So again, thank you for your time, and we look forward to reviewing those and hopefully talking to you in the near future.
Great, thank you everyone. Have a great day.
Thanks everybody.
Thanks.